Okay, let's start out with just a little history of the health reimbursement arrangements. Years ago, I helped physician dental offices set up Section 105 plans, or what we'd call a medical reimbursement plan or health reimbursement arrangement. There's different names for it. But basically, what we had situations where the doctor would receive health insurance, or maybe their key employees would receive health insurance. Their maybe the PAs and the hygienists in a dental office might have health insurance, and yet the clerical, clinical staff did not. But the doctors really wanted to provide something to their staff to help them with their medical costs. So we'd set up a 105 plan, a written plan, and it was a great option for small employers. They would set a limit, say between $3,000 to $5,000, and say to their employees, if you have out-of-pocket medical costs, you can turn them in to us and we will pay those costs. We'll reimburse those costs to you up to a certain limit. That might be, like I said, $3,000 to $5,000. Well, that worked great for a long time, and then came along the Affordable Care Act. And the Affordable Care Act basically required these medical reimbursement plans to provide compliant minimum essential coverage. And they were not, so basically they couldn't have limits. You couldn't say, well, we'll limit the medical cost to $3,000 or $5,000. You couldn't do that. And you also had to make sure that the plans were basically equivalent to a health insurance plan, which made it to the point, and here's the kicker, was if they were non-compliant and you didn't do that, then the employer was subject to a $100 per day per employee penalty. Well, needless to say, all my doctor clients said, we are not going to have this plan anymore because we can't do it that way. So what did employers do? Basically, they either dropped the 105 plan, the medical reimbursement plan, and they didn't offer health insurance to their employees. So we had to drop that because it was just going to be too costly. Now you have to remember too that when the Affordable Care Act came about, not only was the 105 subject, it couldn't have limits and had to provide compliant minimum essential coverage, but you also could not discriminate. So if you had a health insurance plan that you were offering to your doctors or the key employees, you couldn't do that and deduct it in the corporation and then not have the plan available for your regular clerical clinical staff. So that's why they would drop the health insurance. Now, later on, I think it was in 2017, they came out with a qualified small employer health insurance reimbursement, which basically said you could have a medical reimbursement plan, but only for certain benefits, such as dental or vision. And then there was an IRS ruling where people understood that the 105 plan was really very similar to health insurance, and so they would pair it with a group term or with a group plan, health insurance plan, and then they could have an HRA. So if they wanted to couple that with a group plan, they could do it. However, it was still very costly because you still had to have a health insurance plan, and a lot of small employers, such as the clients we serve in the healthcare industry, just didn't want to put out that kind of money and pay for those kind of costs. So instead, what we did was we would set up a group health insurance plan, we would say the corporation will have that plan, but all employees have to pay 100% of the premiums. And then we would have a flexible savings account, a Section 125 plan that would allow the employees to take money out of their paychecks each pay period, pay for that health insurance. Now, if they didn't want it and they opted out, they could do that. And then obviously those that wanted to pay for it and had it available would have it through the company. So working through that process. So here's the slide. We just talked about that. Options they considered: stop providing health insurance to avoid the $100 a day per penalty, and then also purchase a group plan using the Section 125 plan. You would either offer no insurance dollars, or maybe you have some kind of a hybrid, but all employees, would have to pay. I had some groups that said, no, we're just going to go get a group health insurance plan and we're going to pay for it. That's just going to be cost of doing business. Others said, we're not going to offer anything. And so there's a little bit of both worlds. But this new ICHRA plan, I think, is really a good option. So like I said, starting in January 1, 2020, the ICHRA plans will be available. Let's just talk briefly about the pros of having an ICHRA plan. First of all, it's tax-free. For your employees and anybody who receives any reimbursements, it's income tax-free for all employees. It's available to businesses of all sizes. Now, while I think it works really well for those under 50 employees, and we'll talk about that a little bit more later on, it is available for businesses that have more than 50 employees. So practices that currently have health insurance and maybe offering some kind of hybrid, this is a perfect time to look at the ICHRA plans. Businesses can choose eligibility requirements. So we're going to talk a little bit more about that in a minute. It does come with some minimum participation requirements. It gives businesses control over their benefits, allows you to budget what you're going to pay for health insurance costs. There's no maximum contribution limits. Businesses can offer different allowance amounts for different employees. We'll talk about that in just a little bit too. Administration is simple. However, I would recommend that you use ICHRA administrator, some kind of a third-party administrator that manages the process for you. It gives employees a choice to opt out if they have the premium tax credits, which we'll talk about as well in just a little bit. And then the cons of an ICHRA plan is that employee classes are narrow, but stay tuned. As I said earlier, this is a perfect plan for those that are 50 employees or less. And so that is something we may want to take a look at. It may be unfamiliar to employees. That's another con, is that this is fairly new, so they won't know all that much about it. It doesn't provide benefits to uninsured employees. So if you have an employee on a spouse's group plan or employees with a health care sharing ministry plan, you can't have, they may not participate in the ICHRA plan. And employees must choose between the ICHRA or the premium tax credit. And again, talk about that in just a little bit. Administration is complex without an ICHRA administrator. So you can do it. It is simple with an ICHRA administrator, but like I said, you're going to want to use somebody for that. So how does the ICHRA plan work? Well, first of all, you have to establish a plan. It has to be a written plan. You set a limit. You pay employees for insurance and for out-of-pocket expenses. So let's talk about an example. Let's say that you decide you'd like to offer your full-time employees $5,000 or more. Maybe you say, hey, I'm gonna set a budget of $8,000 for every full-time employee. Then they go get their individual health insurance on their own. They have to show that they've done that, and then you can reimburse them for their premiums and out-of-pocket costs, but you limit your cost to that set limit, $8,000. You can't discriminate, and we're going to talk about various classes and what's the makeup of those classes. You can't discriminate, but you can provide different amounts. So let's use our full-time employee example. Let's say that we say we're going to give our full-time employees the option to use an ICHRA. And for single employees, those not married or without children or at a certain age, they get $8,000. But those with a spouse and or children or a family, they're going to get $12,000. You can do that. However, like you said before, the whole family has to be covered by that individual plan. So they have to have a plan and show that they have the plan, and then they can be in the ICHRA plan, and you can pay for that. Okay, let's go to the next slide. One of the questions that probably will come up is, as the business owner, am I eligible? Because a lot of times with various employee benefits, there are limits to the employer, or there's certain tests that have to be satisfied in order for the employer to participate and gain advantage of a particular benefit. Well, in the ICHRA plan, you are eligible to participate, but how you do it and how you get that benefit depends on your business structure. So the ICHRA plan is for all employees, and if you are a regular C corporation, part of a corporation in your practice, you and your employees are eligible to participate. So you just define the rules, how it's going to happen in the plan, and you're an employee just like any other employee, and you may participate in the ICHRA plan. If you're an S Corp shareholder, you're still an employee, but if you're more than 2% shareholder, you have limitations on your benefits. However, for health insurance, the 2018 health insurance for S Corporation owners, the alternative to deduct the health insurance on your schedule on page 1 of your 1040 is still available. And these costs in the ICHRA plan would also follow the same rules. So you could still participate, it's just the way in which you take your deduction is going to be different. So your employees will take it on your schedule or on your corporate income tax. We would deduct the cost there for the employees, but for the shareholders, the money would be added to your wages in your W-2, and then you would take the deduction on page 1 of your 1040. Now, sole proprietors, if we don't have that many, but there are some that operate as a sole proprietor, in that case, you can have an ICHRA plan for your employees. However, you as the owner are not an employee, you're not classified as an employee. So the only way to get past that is if you're married, you can hire your spouse. you can then cover your spouse, and your spouse would then have the ICHRA plan, which would cover you. However, if you're not married, or if your spouse is truly not working or not providing benefit to your business, then it's really kind of hard to hire the spouse, because you have to meet certain minimum requirements there as well. But it is an option. So again, it is available for the business owner. It kind of depends on what kind of business entity you are in order to take the deduction, or at least where it goes. Okay. All right. Who are, as far as being eligible to participate, ICHRA plans are only available to employees who are enrolled in a individual health insurance plan. Now, that can be part of the individual insurance exchange coverage, other individual health insurance coverage, or even Medicare. If you already offer traditional group health insurance plans, which some of my clients do, you cannot offer an ICHRA plan to employees who are eligible for the group plan. So you got to be careful about that, because if you already have the group plan, adding an ICHRA plan isn't going to be helpful. However, we'll talk a little bit in a few minutes about a grandfather clause. But basically, employers are legally barred from giving employees a choice between a group plan and an ICHRA plan. You can't have both. So I think for some of my smaller practices where they purchased a group plan, they may want to take a look at maybe not doing that any longer, and then look to the ICHRA plan as a possibility. You can offer traditional group health insurance plan to some classes of employees, and then ICHRA plans to the other class of employees. So that's another option. And then, like I had said, there's a grandfathered rule as well, which we'll talk about in just a minute. Here are the types of classes that you can set up inside of your business. You can have, like I explained earlier in my example, was full-time. You could say, you know what, I'm going to offer the ICHRA plan to just part-time employees. That's it. And so, you know, all part-time employees are going to get a ICHRA benefit medical reimbursement plan of up to, and then state the number, whatever you want it to be. You can choose a location if you are part of a, you know, multi-location place. You could say, well, it's going to be offered at this location and not another. I'm not sure why you'd want to do that, but you can. Probably just depends on the type of business you are, but in a medical dental practice, I would think that would be hard to sell to your employees. Seasonal employees, which may not, you probably wouldn't do that. Employees covered by the same collective bargaining agreement. We don't have collective bargaining agreements, so that's probably not an issue. Employees who have not satisfied a waiting time or waiting period, or so you could say, I'm going to give the ICHRA plan to anybody who has been here for 90 days or longer. That might be a way to cover all your employees, but they had to be here for a certain period of time, or maybe they have to be here for a year before they get into the ICHRA plan. That would be another option. I'm not going to talk about the other ones. You can read them there on the slide. And if you have questions about classes of employees, you can let us know. Now, I mentioned that there's a grandfathering option. And if you have a plan now, currently have a group health insurance plan, you can keep it and then offer the ICHRA plan to any new employees that should join your practice. So I know that I have some smaller groups that went ahead and purchased group health insurance. It was just easier, and they thought they wanted it for themselves, and they didn't want to pay for it out of pocket. They wanted to deduct it for themselves, and running the numbers, it seemed to make sense. So they did that. Now they may want to get to a point where, you know, they want to just leave that health insurance in place, but then start offering ICHRA to any new employees. Well, be under the grandfathering option, that's a possibility. Now, when you look at the classes of employees, members within a class must be treated comparably, though different amounts can be offered. So, like I said before, I could have all full-time employees be part of the ICHRA, yet I could have different amounts maybe for single versus families or couples, or, you know, you could do that sort of thing, or you could just base it on the number of children people have. If they have, you know, more than 3 children, you're going to give them more. It's up to you. And the beautiful thing is that it is up to you, and you can decide how you want to spend your dollars and what kind of benefits you want to give to your employees. Now, there is a minimum class requirement. So for most of my clients that are under 100 employees, you can only have a class, or the minimum class size you could have would be 10 employees. So you think about that. If we had 20 employees or 40 employees, we could have 2 or 4 class groups, okay? But for smaller employers where that might not be a case, it would be harder to have more than maybe 1 or 2 classes. Maybe, you know, you might be able to do it, but a minimum size would be 10. Now, there is a little bit, I want to talk about that class size rule, and that is the class size requirement applies to you only if you offer traditional group health insurance to at least one other class of employee. And then you offer the ICHRA to at least one other class of employees. So you got to watch those classes. However, if you have no health insurance plan, you don't offer it in your business, you face no class size requirement. So then you could have multiple classes and so on, set up the classes, put it in there, and then not worry about whether that minimum size. So that's why I asked at the beginning, if you have fewer than 50 employees, so you would be subject to that 10 per, but if you don't have a health insurance plan and you want to help your employees with health insurance, having the ICHRA plan is a great way to do it. Okay, let's talk a little bit about the integration with cafeteria plans. Now, I mentioned earlier in conversation that we would have a Section 125 plan. Sometimes they're called flexible spending arrangements. They'll be called cafeteria plans. But if the ICHRA doesn't provide enough money to cover your employees' premiums, let's just say you decided that you were going to give every employee, regardless of whether they're full-time or part-time, the ability to participate in your ICHRA, and you are going to limit that to $5,000. And let's say that one of your employees gets the health insurance, signs up for individual health insurance, and the health insurance is $1,000 a month or $12,000 a year. Well, then obviously they're short the $7,000. They've got to pay for that out of pocket. Well, the nice thing about pairing this with a cafeteria plan is you could offer a Section 125 plan that would allow the employee to take that $7,000 out of their pay and pay that individual health insurance plan, which wasn't allowed in the past. You couldn't do that. Now you can. You could pay that health insurance, and the employee would pay for that benefit or for that plan that he or she's purchasing with before tax dollars. So they're saving tax dollars by paying for it. Instead of having to pay Uncle Sam, then take money out and go pay for the premium, they're paying for the premium, and Uncle Sam gets cut out of the equation. So I do think that is something to consider. Just note, though, however, that option is only available for employees that purchase individual insurance plans that are not part of the government exchange health plan. So you can't buy health insurance through the exchange with Section 125 plan, cafeteria plan dollars. Okay, you can buy the exchange health plan with the ICHRA plan dollars, but you cannot with the Section 125 plan. And the reason for that is what we're going to talk about next. ICHRA basically is eliminating the premium tax credit. So the premium tax credit, which is a federal government tax credit based upon family income, overall family income, not just one individual, not the taxpayer's adjusted gross income or taxable income, but the whole household income, everybody living under the household. If that is below 4 times the stated poverty level, depending on what state you live in, you get a tax credit. And that tax credit can be used to reduce the cost of the insurance. Or you could get a credit on your tax return. That's why they won't let you use a cafeteria plan, because basically you're getting a tax benefit. You would go use that money to go buy the exchange, and for those that fall under that would get the premium tax credit, it's like they're getting double dipping on the tax savings, and they don't want that to happen. The premium tax credit is available, though, however, if you're using a qualified small employer HRA. Now, remember when we talked about that earlier, that was in about 2017, they said you could have a qualified small employer HRA, but it had limited reimbursements. Okay, so you could use that. But basically, if you're in an ICHRA plan, your premium tax credit is gone. It's eliminated. So an employee has a choice. They may participate and say, yes, I want to participate in the ICHRA plan. But then if they do not get the premium tax credit. So it's gone. They have to choose, or they can say, no, I don't want to participate in the ICHRA. I'm going to take the premium tax credit. And then that will depend, each employee's decision will depend on how much the employer is giving in the ICHRA. So it really comes down to, are they getting a better benefit from the premium tax credit, or are they getting a better benefit from you, the employer? Okay, the annual and ongoing certification requirements. ICHRA requires that the plan sponsor, the employer, has to keep track of 2 types of substantiation. Annual coverage, which means that all participants in the plan and covered family members must certify that they are enrolled in an individual health insurance coverage plan or in Medicare. And then ongoing, before receiving a reimbursement, participants must certify that the person who incurred the charge, whether it's themselves or a family member, was covered by an individual health insurance or Medicare during the month the charge was incurred. So here's where I'm going to say it's best to get a third-party administrator involved and have them run that for you. So all the certifications and everything that happens when the money is being submitted or the reimbursement's being requested, that they deal with a third party and they don't deal with you, the employer. But you set up the rules. You work with your third-party administrator to do that. The Department of Labor does have model notices and forms for doing all this, and you can do it yourself, but I just recommend that you don't. I just say use a qualified third-party administrator. It'd be a whole lot easier, but I think it's something that really is worthwhile looking into. All right, some of the rules and regulations, as I mentioned previously, it starts January 1, 2020. The ICHRA is subject to ERISA, which means that you have to give certain notices and you have to have a written plan and you have to do the attestation and the certification and making sure that all those rules are followed. It's basically making sure that, ERISA was a federal law that set minimum standards for voluntarily established retirement plans and health plans in the private industry to protect the individuals in these plans. So, yeah, there are rules to follow. That's what ERISA is all about. And so you got to do that. Now, for this year, in the first year, there's no 90-day notice. So if you are urgent and want to get this started, you could do that for January 1. There wouldn't be any issues with not giving the employees 90-day notice, and you could get started right away. As I mentioned before, you must have a plan. You have to follow the documentation rules. There has to be a summary plan description, just like a retirement plan that you give to the employees that explain the plan. It would explain the eligibility rules and opt-out elections, etc. The good news is that individual insurance is not subject to ERISA if safe harbor rules or requirements are met. And what are those safe harbors? Here they are. An employee's purchase of any individual health insurance is voluntary, okay? They have to make sure that it is voluntary. And the fact that the insurance coverage must be purchased in order to participate in an ICHRA does not make it involuntary, okay? So it has to be voluntary. The employer does not endorse any specific issuer or insurance coverage, okay? You may provide general information. You could say to your employees, hey, go look at the healthcare.gov or go look at the state insurance commissioner or something like that. But you wouldn't want to set up a meeting in your office with your brother-in-law who sells insurance. That would be against the rules. That would not meet the safe harbor requirement, because now you're endorsing somebody or giving them the information. I just don't think it'd be a good idea. But giving them general information about where to go get it, who to call, that sort of thing, I think would be fine. Reimbursement for health insurance premiums is limited to health insurance coverage that does not consist solely of accepted benefits. And so accepted benefits are such as vision and dental coverage, long-term care insurance. So you couldn't have a dental insurance. They couldn't go get a individual dental insurance plan and then be covered under ICHRA. The employer does not receive cash or other kickbacks in connection with the employee's selection or renewal coverage. So that's, I guess, where, I don't know, I guess I would look at maybe the brother-in-law situation, right? You're going to get some kind of a kickback by getting an insurance agent into your office that will help the employees get their individual insurance. And because of that, you're going to get something in return for making that connection. All plan participants are notified annually that their individual health insurance coverage is not subject to ERISA. So I think that's something that your third-party administrator would help you do and make sure that those notices are done and the rules are followed. So in summary, here's the takeaways. Here's just kind of a recap of what we talked about. If you're an employer looking to provide some assistance with health insurance costs or looking to restructure your current plan, then looking at the ICHRA is an option to consider. If you have a qualified small employer health reimbursement arrangement, the one that we talked about that took place around 2017 that offered reimbursements of very limited amounts, I think it was up to $2,500, then that's still a good option for small employers. You don't have to switch to an ICHRA plan, but the ICHRA does provide more flexibility, and it's also available to large employers, meaning any employer that has more than 50 employees. The ICHRA provides a way to reimburse employees for some or all of their health insurance, premium costs, and out-of-pocket medical expenses. You choose the amount. There's no limitation on rollover amounts or the size of employer that can participate. You have the option of offering traditional group health insurance and the new ICHRA as long as you don't offer both to the same class of employees. So that's our presentation today on the ICHRA, or the Individual Coverage Health Reimbursement Arrangements. Again, I'll remind you, if you have any questions, please submit them via email to mike@mdmanagementgroup.com. And with that, I wish you a very blessed day, and we'll talk to you soon.